Okay, so today I'm going to be talking about a paper that is joint with Martin Ravalian, who's at Georgetown University. Hopefully you can see the whole slideshow. I'll assume you can. So this paper kind of came out of what we were seeing at the early start of the coronavirus in the United States. And so basically what we were thinking about is how do socioeconomic covariates, such as poverty and inequality, matter to how people respond to COVID-19? And what does this mean for outcomes in terms of both cases and for deaths? So we know now that COVID spreads when there is what's called an effective contact between an infected individual and an uninfected susceptible person. So you'll be walking around and somebody who's infected with COVID will infect you with COVID, and then so on and so forth. So the disease spreads when each infected person infects other people. And so in absence of a vaccine and any other type of kind of pharmaceutical-based treatments, what the policy response has been has to be reduce this kind of effective contact, and that has been predominantly through mask wearing and social distancing. However, these two things, these two recommendations are personal choices. You choose whether or not to wear a mask, and you choose whether or not you are going to comply with social distancing recommendations. And these choices that you make are going to be influenced by various socioeconomic characteristics, i.e., what makes you the person that you are in an observable way. So in particular, it could be your employment type, it could be your housing, where you live, the population density, and all of these kind of socioeconomic covariates we're going to broadly summarize into poverty, things that are related to poverty and inequality in particular. So we do know that when you have a choice of whether or not you're going to do something, say, for example, social distancing, you're going to be trading off the costs and the benefits from that particular behavior. And in particular, the benefit from social distancing is that you're going to have a lower probability of catching the virus. But social distancing also comes with a cost. Okay, so you have to stay home and reduce the amount of social interactions that you have with other people. And these costs are going to differ by these socioeconomic covariates. For example, I am a relatively highly educated academic. I can stay home and work. I can do my job from home, and it really does not cost me very much. I still get paid. I can still do my job perfectly effectively. If I'm somebody who works as a cleaner or a train driver, I'm not able to do my job from home. And it's true, therefore, that people in various positions, which are usually lower paid, those types of people are probably going to have a harder time complying simply because they're going to live in more denser areas, their housing is going to be less appropriate, and their employment situation is not that they can stay home. So how we're going to think about these kind of costs of social distancing is in two ways, okay? So the first is what we're calling a protection effect, where your socioeconomic status, and in particular your poverty status, is going to affect your ability to avoid infection through social distancing. Okay, so you're going to be less able to practice social distancing depending on your socioeconomic status. And here we're thinking that you're going to be more able to comply with social distancing the higher your socioeconomic status. It's also true, however, that people have different levels of social interactions to begin with. So if I'm living in Manhattan and I spend a lot of time at bars and restaurants and I have a lot of friends that I go and see all the time, then my level of social interactions are going to be very high, and it's going to be more costly for me to significantly reduce those relative to somebody that has fewer social interactions to begin with. And this is what we're calling an adjustment cost effect. So we have these kind of two different effects that we're thinking about. And as a result, it seems a priori unclear whether poverty is going to, how poverty is going to matter to whether or not you social distance, and indeed whether or not you're more or less likely to catch coronavirus. What is also kind of confusing is that there's a whole bunch of other covariates that are correlated with each other. So particularly when the coronavirus back in the spring, when it was first coming out, people were saying things like, okay, so population density matters, health preconditions matter, age seems to matter. But all of these things are correlated with each other. And there's also poverty that's behind it that did not receive a lot of attention. And poverty is also correlated with population density and health preconditions and age. So if we take age, for example, and show how age can be somewhat ambiguous in terms of its effect, if you're older, you're going to have more health preconditions, but at the same time, you're also going to have fewer social interactions. Perhaps you're retired, you don't work, perhaps you live in a rural area, you're not going to be interacting with as many people as, say, for example, a young professional in New York City. And so what we're going to try and do in this paper is we're going to try and disentangle all these potential covariates and see their impact on both how well, or your likelihood for social distancing, as well as the impact that these socioeconomic variables have on infections and deaths conditional on infections. So empirically, so this paper was written back kind of in June. And so empirically, what evidence was there to inform our understanding on these issues? It's still the case, even in late August, that information that links socioeconomic characteristics and your status in terms of your health with coronavirus is extremely rare. So we aren't able to kind of run these regressions and disentangle these relationships at the individual level still. So what we do instead is we're going to use county level data. And the nice thing about the United States is that there is relatively large amounts of data at the county level, which we can all merge together and come up with a pretty cool data set for which we can kind of start to disentangle the impact of these covariates. So basically, we're going to be creating a data set that's at the county level, where we're going to be merging on socioeconomic characteristics such as average incomes, race, income inequality, poverty, other socioeconomic covariates, which are prevalent in the epidemiological literature, and also as well as county level cases and deaths. In particular, the data sets that we're going to be using is we're going to be drawing from Unicast's social distancing scoreboard, which essentially uses GPS data to compare movements of people before and after coronavirus, let's say. So they take kind of like a baseline, which is back in the middle of February, I think, and then they compare it to, say, for example, what people are doing in March or in April or in May. We also use Google data as well as a robustness check, which is basically very similar in terms of how they get their data and what they use it for. In terms of outcomes, we predominantly draw, so our main regression results are using data from the CDC, but it's quite obvious that maybe this isn't the most reliable data. So we're also going to be using data that we get from the New York Times as a robustness check. We have some measures of other things that we might be interested in, such as excess deaths and testing data. and also health indicators, and these come from other various places. So the regressions that we're interested in running are essentially, we have three main ones. So the first is that we're going to have the impact of these socioeconomic characteristics on social distancing. And from the unicast data, this S here is, it's an ordinal variable. So basically what they're doing is they're ranking social distancing responses, and you get like a grade. So each county in the United States has a grade about how much they've changed their social distancing behavior. So if you change it a lot, you're going to have a higher grade than if you change it very little. So that's the outcome variable. In terms of the other covariates that we're going to be running in this regression, we have the number of days from the time of infection. We have our socioeconomic characteristics here, and those are going to be things like race, income, poverty status, income inequality. And then we also have the population here. In terms of cases, we're going to be running this. So in terms of the outcome variable, this is going to be simply the number of cases in a particular county. And we're going to be using an exponential model because the epidemiological curve, which we've probably seen like a million times now, is kind of that logarithm type relationship. So instead of writing this as having, say, for example, log cases on the outcome variable, which is what we run in practice, I'm just going to write it as having an exponential function, but essentially it's the same thing. Here we're also including the days since the first infection in the county. We have the same socioeconomic characteristics and as well as the population. So I here is going to be at the county level. And then finally, we're going to have our deaths, which again is the number of deaths in a particular county. And here the regression is slightly different. So here we're going to be having health preconditions because we think that that matters to death. It's less obvious to us how health status, so for example, whether or not you have diabetes and other health preconditions, which we know are correlated with the severity of the disease. It's less obvious to us how these health pre-characteristics are going to affect cases. So we don't include health in the cases regression. We're just going to include it here in the deaths. Given that health is also correlated with these socioeconomic characteristics, we're going to include them. We're also going to include socioeconomic variables here. And of course, in order to die from coronavirus, you have to have coronavirus. So we think that deaths are also going to be dependent on the number of cases. In terms of the regression that we run, because the cases and deaths are not normally distributed, there's obviously like some counties which have a huge number of cases and deaths. So we're going to be using a negative binomial specification, which we estimate using maximum likelihood. And then in particular, the problem with the deaths regression is that cases are endogenous, right? So, so we're going to be using a control function approach to account for endogeneity. Given this is a relatively short presentation, I won't go into too much detail about the identification strategy. So what do we find in terms of some of our main results? So we know now in August that social distancing matters to cases. Social distancing matters in terms of slowing the spread. Okay, so we know that if we just plot a simple correlation between the reported cases in a log scale and your performance in social distancing, the higher your performance, the lower number of cases you're going to have. And we can also, this is also a true relationship if we run the graph on the right. This is simply just stratifying by counties who have relatively high number of cases or relatively few number of cases. We find the same negative relationship. So this is essentially saying that social distancing does matter for cases. In terms of our regression results, I'll present the ones for social distancing first, and our results are robust regardless of whether we use unicast social distancing outcome variable or Google's outcome variable. And so what do we find? So remember that a higher score for social distancing means that you're better at it. And so what we find is that higher counties that have higher density are less able to social distance or have less improvements in social distancing, which tends to make sense. Population also seems to matter, particularly when we include state fixed effects. Days doesn't really seem to matter. So whether or not, how long coronavirus has been in your county doesn't really seem to matter in terms of how you adjust your social distancing behavior. And when we get to the socioeconomic characteristics, that's when things start to get very interesting. So we find, thanks. So no, you're fine. So what we find is that a higher median household income means that you're more able to social distance. Older people, a higher share of an elderly population also means that you have greater improvements in your social distancing. Income inequality does not seem to matter. And interestingly, poverty does seem to matter also in a positive way. Now, where things start to become a little more confusing is this role of race and how this matters. So if you think back to kind of the start where I was thinking about these kind of protection effect and adjustment cost effect, the median income and poverty seem to be fairly consistent with both of these effects, right? But the share of Black Americans, the share of African Americans in a county has a negative effect. And we think this is being driven by employment type. So the share of African Americans seems to be highly correlated with the types of employment that people have, and in particular, whether or not your employment would be classified as something that is an essential worker. And so we think this is driving this negative effect, i.e. that you're less able, counties that have a high share of Black Americans have less improvements in social distancing. In terms of cases, if I bring your attention to the second column here, we find very similar relationships in terms of higher density means that you have higher cases, higher population also means you have higher cases, and of course, the number of days also matters positively to the number of cases. This all seems very standard and consistent with what's been reported so far. Interestingly enough, we find that median household income is positively associated with the number of cases. So this speaks to this kind of adjustment cost effect, where we think that people, richer people, have higher initial levels of personal interactions, and therefore are maybe probably less able to kind of reduce those in a way that, I mean, yes, they're going to have better social distancing differences in the social distancing score, but it doesn't mean that they're still not having any personal interactions. The share of an elderly population matters negatively. So if we have a higher share of an elderly population, you have fewer cases. And this speaks to the idea that elderly people are probably not really interacting, or they're probably more likely to be in rural areas relative to younger people. Higher income inequality matters positively, as does the poverty rate. But if we then include our race variable, what happens is that these income-related variables drop out. So it's not poverty, the poverty rate per se, that seems to be driving a higher number of cases. It actually seems to be a high share of Black Americans. And again, this is speaking to employment type and socioeconomic status, but it seems as though race is mattering much more than the poverty rate per se in terms of what is driving infections. So generally, we find a strong effect of race separately to poverty. Racial composition knocks out income poverty and inequality. And this is consistent with observations that essential workers, particularly in healthcare and transportation, are more likely to be Black Americans than the population at large. And interestingly enough, the role of population density is significantly reduced once we account for racial composition. These, in terms of the opposing effects of an elderly population, I didn't present the results for deaths, but we do find that while we have a negative effect of cases of an elderly population, we have a positive effect of an elderly population on deaths, but these two kind of roughly knock each other out. So it seems though that this idea that elderly population are going to be or have higher death rates is not necessarily true. Conditional infractions. Okay, and I'll wrap it up here. Thanks.